Hi, my name is Anya Wilak. I'm from Rasmussen College School of Nursing, Bloomington campus. I'm here to address pathological condition diabetes mellitus type 2. Okay. The Center for Disease Control and Prevention claims that more than 29 million of Americans has type 2 diabetes. It is over 9% of American population. With the disease so commonly known and widely spread, why is it that 1 in 4 people doesn't know that they have diabetes? Let's take a closer look at this disease and explore its causes, symptoms, and how it affects human body. Diabetes is a bit complicated disease. It is not like some other chronic diseases, for example, osteoporosis, that it's easy to determine the cause. Scientists don't know exactly what causes that. At some point, body builds resistance to insulin and starts to have difficulty managing the blood sugar levels. But by studying the different people suffering from diabetes, they were able to determine that obesity is a leading trait common for people developing type 2 diabetes. With that being said, another factor going hand in hand with obesity is a low activity level. Also, very often people who live unhealthy lifestyles, people who smoke or don't get adequate amount of sleep, for example, people who work nights, also are at risk of developing type 2 diabetes. Recent research has shown that also people who are suffering from a long-term depression are more often prone to get diabetes than people who don't experience depression at all. Some races are more prone to developing diseases like Hispanic, Black, or Native Americans, more likely than people of white race. And of course, lastly, heredity has something to say in the area of making you more prone to becoming diabetic. For example, my husband's dad had diabetes type 2 diagnosis, and now my husband at age 40 is already facing prediabetes. Symptoms. As I said before, 1 in 4 people doesn't know that they have diabetes. I think it happens because at early stage, people who have diabetes don't show or experience any symptoms. It can take a few years for a person to live with diabetes and not realize that it's time to see a doctor. At the beginning stages of diabetes, a person might be experiencing episodes of excessive night sweating or feeling tired and not knowing why. As the disease progresses, dizzy spells or vertigo are more common. Sometimes people might experience blurred vision. And one day, there comes that yearly checkup and that the healthcare provider notices elevated blood pressure. After reviewing your symptoms, sends you to the lab, which very often will reveal high cholesterol and triglycerides levels. Also, blood glucose will be abnormally elevated. Sometimes people find out that they have diabetes because they visit a doctor for a wound that does not want to heal. Blood-high glucose is a perfect environment for bacteria to grow, slowing down the tissue repair process. Treatment. Once an individual gets the diabetes diagnosis, as overwhelming as it might seem, the step needs to be taken to prevent the disease for progressing. It doesn't matter at what stage of the disease a person is, the 3 non-pharmacological ways of treating the disease have to happen. First, person needs to focus on losing an excessive weight. Start on exercise scheduled to help body burn some of the excess blood sugar. And of course, both of those elements, the weight loss and exercise, will be supported by a healthy diet. Diabetic diet doesn't mean that all of the sugars have to be excluded, or a person cannot have any more alcohol drinks or candy or cake. It just means that it has to be really limited, and a person is highly encouraged to eat healthier foods. The diet should be rich in vegetables. The proteins should be prepared in a healthy way, meaning that preferably no fried foods, grilled or baked or broiled. proteins are much more appropriate, and simple carbs are encouraged but be to consumed only in small amounts, and more appropriate would be consumption of the complex carbs which come in the form of the whole grain products. If the non-pharmacological ways of treating the disease are not enough in managing blood sugar, the doctor might prescribe pharmacological approach in the form of oral medication or insulin injection. Oral medication help to decrease the production of the glucose. Insulin injections are given on the higher stage of diabetes, when the person cannot manage its symptoms by the diet change or oral medication. And we've got several different types of insulin. We've got long-acting insulin, we've got short-acting or rapid-acting, and once again, it depends on the individual needs that the doctor prescribe what type of the insulin, what time, and how often it needs to be taken. Short-term consequences of diabetes. When we think about diabetes, we usually focus on those high or low blood sugar levels and addressing those issues. And those fit perfectly in the short-term consequences of diabetes. The blood sugar can either fall really low, causing hypoglycemia, or reach very high abnormal levels, leading to hyperglycemia. Hypoglycemia and hyperglycemia have an effect on the body that mostly causes discomfort to a person experiencing it. In the case of low blood sugars, the person might experience confusion or weakness, sometimes shakiness. The person might appear to be irritated, and very often their skin will be sticky and clammy. In case of hyperglycemia, high blood sugar level will lead to increase in thirst and what comes with the increased urination. Also, headaches are present, confusion, and the skin is hot and dry to touch. Those short-term consequences can be relatively easily addressed in the short term. In case of hypoglycemia, insulin shot can be given. In case of hypoglycemia, either glucose injection or consumption of some simple carbs might help boost up that blood sugar levels. But if those conditions don't get addressed at the time when they are needed, they might lead to more fatal situation in the shape of seizures, coma, or even death. When it comes to long-term consequences of diabetes type 2, the picture is much more wider than an average person can imagine. Most of us associate diabetes with managing, discussed in a previous slide, short-term effects of diabetes. But not everyone realizes that diabetes affects almost every single tissue in the body. Since glucose travels through the body with the blood to any place that the blood goes, those tissues will start being affected by its abnormal values. The time constraints does not allow me to go deeply in details about how each tissue are affected, but let's focus on a couple major tissues and organs. Long-term consequences can be divided into two categories: microvascular and macrovascular. Microvascular complications affect many organs, and to most known disorders belong neuropathy, nephropathy, and retinopathy, which I will shortly address in the following slides. Macrovascular problems affect the big blood vessels and can lead to the cardiovascular diseases, stroke, or heart attack. Neuropathy. It is caused by damage to the small blood vessels and nerve endings to the chronic high blood glucose level. It is manifested by lack of sensation and numbness, and this might lead to the complication like development of ulcers and muscles atrophy. In a fatal stage, it might lead to amputation of a limb. Nephropathy is caused by damage to the small vessels in a part of the kidney called glomeruli. As a result of albumin level in urine are abnormally high, which means that this type of protein was able to leak through the damaged vessels to the urine. Albumin is a protein produced by the liver. In a fetal stage kidney, it leads to the kidney failure. Retinopathy results from the microvascular complication caused by the blood high in glucose, and it involves changes to the blood vessels in the retina, which can bleed or leak capillary fluid, causing disturbance to the vision. In a fatal stage, it might lead to blindness. Excuse me. The macrovascular problems are pretty straightforward and come as a result from diabetes, as well as factors contributing to diabetes like obesity or unhealthy lifestyle. The biggest direct cause contributing to the macrovascular problem is the fact that the high blood glucose level contributes to the blood thickening, which increases blood pressure. Part of the macrovascular problems also is a blood flow insufficiency to the legs, which in a fatal stage might lead to the muscle atrophy and then amputation of the leg. Okay, thank you. I hope this short presentation addressed some of the major concerns associated with type 2 diabetes, woke up some curiosity and courage to the further research of the subject. Thank you so much, Ania Wilak.